Hello viewers, welcome back. Let there be light. It's a little blue though. It does make my eyes look really blue. But anyway, so welcome back to my channel. I wanted to take this opportunity to start talking about a topic that I am most passionate about and have quite a bit of knowledge in, which is healthcare. So as my previous videos stated, I have worked in the healthcare industry for a very long time. I actually got my start as a medical administrative specialist in the Air Force. I was stationed in Hickam Air Force Base, Hawaii, which was awesome. Hawaii is still my favorite place to this day. But I went from there. I decided just to stay in the industry because I enjoyed doing it. I've worked in the private practices, I've worked in the public hospitals. Back in 2013, I went back to school and got certified as a medical assistant. And so I now have a lot more hands-on patient care, which I just absolutely love. I've worked in a very large private practice setting for the last 3 years and enjoy it very much, but I'm starting to get a little depressed. I have to be honest. I am seeing a tremendous amount of people who can't afford care. They can't afford diagnostic tests or medications or inhalers for their children. It is incredible to me how much the cost of prescription drugs, if they improve the quality of life or save lives, it seems like the prices have just been jacked up enormously over the last several years. And I have to wonder, are they trying to kill us off? Because it seems like they're trying to kill us off. We need to maybe look into that. But no, I wanted to talk about healthcare because there's so many misunderstandings out there. There's so many people that reject it when they really don't even really understand what it is that progressives are pushing for. So I just wanted to break it down and give you guys some stats just in case you haven't heard them. Right now, we're the only major country on the planet that does not guarantee healthcare as a right. Every other developed nation has a universal type healthcare system where it's paid for through their taxes. People like Ted Cruz love to fearmonger and tell you that your taxes are going to be raised up enormously to pay for this very expensive $32 trillion over a decade. Blah de blah de blah. They don't give you the full story, and I'll do that today in this video. So yes, the Medicare for All single-payer healthcare system that Bernie Sanders has proposed, for example, will cost the country $32 trillion over a decade. But what the detractors seem to leave out, conveniently or ignorantly, is that it will save anywhere from 2 to 17 trillion based on some different studies. It'll save us 2 to 17 trillion dollars over a decade from what we're paying now, and it will cover everyone. Right now, there are millions of people who don't have insurance at all, and millions of more who can't simply afford to go to the doctor because of the high cost of premiums. So anybody in the healthcare industry will tell you that they've seen a decrease in the access to care and the increase in costs. So by doing a single-payer healthcare system, it will actually save money in the long run because preventative care is much cheaper than letting people just go without it. Take, for instance, a person with diabetes. What do you think would be cheaper? To get that person an appointment every 6 months or so and some blood tests and put them on a cheap medication to control the diabetes? Or do we wait until that person becomes so sick that they lose a leg and then they're on disability the rest of their life? So preventative care is, in fact, a more cost-effective way to manage health care. Bernie Sanders proposed a 2.2% annual income tax. So when Ted Cruz says that Bernie wants to raise your taxes, he's right. It will cost a slightly more in your income taxes. However, you won't have to pay co-pays, premiums, or deductibles. And so that alone will save the average family thousands of dollars a year. I know I currently pay about $380 just for me, and I'm a healthy person, so I don't ever use my health care. It would save me a lot of money to only pay a 2.2 annual income tax. One main reason why people are against Medicare for All is because they think it is socialism. And it can't be socialism when the private sector still delivers the health care. So when I'm talking about health care, yeah, it is true that in America we have the best health care system in the world. It's the access to it that's screwed up, and that's what we need to fix. We're basically talking about paying a system that already exists, Medicare, paying through our income taxes, and then going and seeing a doctor, and Medicare foots the bill. The doctors send the bill to Medicare. Medicare covers it. Easy peasy. I don't understand why we haven't done this already. Every major country on the planet does it with ease, and there are a lot of people who say, oh, well, those people come here for the health care, and that's true, but again, they're leaving out the fact that a lot of people come here for elective surgeries, things that they may have to wait for a little bit in their country, because other countries base their delivery of health care based on need and not want, or the size of your wallet, basically. So sorry guys for all the lighting differences. It started getting too dark outside, and so I turned some lights on in here, and now it's like, ah! Sorry. I'll get it straight eventually. I've had to break this up because I bought an editing software program, and I suck at editing. I've never used these things in my life. So it's literally taken me all day to produce like a 4 or 5 minute video. So I'll tell you now that not sure if that's going to happen a lot, maybe on the weekend videos, but if I start doing videos during the week, it's just going to be raw, unedited, a lot of ums and ahs and going off on tangents that have nothing to do with the topic at hand. So just bear with me, guys, but I appreciate you being with me. I just wanted to make a couple of more comments on healthcare real quick. The one thing about having healthcare is that you don't die prematurely or suffer unnecessarily when you can simply go to a doctor and get treated. I can tell you countless stories of patients that have come into my clinic who, one guy had a chest mass found on just a routine x-ray, but he couldn't afford the CT scan to go see if it was cancer. Another patient just last week we had that's a high risk for heart attack. He couldn't afford the echocardiogram that he needs. And so, like I said earlier, it's so depressing to see people who need care and can't get it. And these people have insurance. Can you imagine the number of people that don't have insurance, that need care? But I need people to be aware that when someone goes to the ER without insurance, those costs are basically shoved off onto those with insurance. We have to stop being a country that makes people go bankrupt because of healthcare costs. That's insane. There are hundreds of thousands of cases of bankruptcy each year that are done because of healthcare costs. Not having a single-payer healthcare system does not make sense from a moral, financial, or logical perspective. The only people who seem to be against it today are the people who are making money hand over fist with our current system. And those people are brainwashing other people to reject it because of socialism. Anyway, I think that we all need to stand up as a country and demand that our government actually promote the general welfare and actually look at getting a healthcare system like everyone else has on the planet, that we can take care of our citizens and be well. Obamacare did a little bit with regard to protecting us from corporate abuse, but it didn't go near far enough, and in fact I would argue that it was a big giveaway to the for-profit insurance company that we're trying to do away with. What is the purpose of having a for-profit middleman in between you and a doctor when that middleman provides zero additional quality to the health care that you receive? People want to know why health care is so expensive. Well, it's because the CEO of United Healthcare makes $14 million a year. 5 executive officers at Humana just raised their salaries 90%. 90%. Can you imagine that? That must be sweet to be able to raise your salary that much in 1 year. Come on. Well, that's the reason why insurance is so expensive right now. It's because they profit handsomely. I would much rather have Medicare handle the payments of my health care that I receive than have it go to a for-profit entity. I will be doing a whole entire video on Obamacare separately because it's going to take its own 5 or 10 minutes to unpack. There's a lot of things in there that people just simply aren't aware of, and so I'm going to break that down a little bit more detail. But anyway, I know that this video has gone a little over 5 minutes, so I know the average attention span on YouTube is I've probably exceeded that. But I'm hoping that you stayed with me, and if you have, please share this video with anyone you think might be swayed to support a single-payer healthcare system like Medicare for all. Thank you so much for watching, and I hope to have another video out soon. Peace and love to you. Bye-bye.